Now I would like to welcome to the programme Sarah Keogh, who's consultant dietitian with the Coeliac Society of Ireland. So thanks very much for coming on the programme, Sarah.
Robin, thanks for inviting me to come in. I'm delighted to come in and talk to you about it.
More than welcome. I'm sure most people have heard of coeliac disease, but maybe people might just have a hazy idea of what's involved. So I suppose the most obvious question is, what is it basically?
It is. And so celiac disease is, it's an autoimmune disease. So it's where the body kind of attacks itself. And the trigger for it is gluten. So if someone with celiac disease eats gluten, the body then attacks itself. And the main place it attacks is the gut. So people can have gut pain. They might get changes in the gut. They might get diarrhea. They might get constipation, bloating. So those things. But the attack actually can go right through the body. So lots of people don't realise with celiac disease that you can have your nervous system affected. So people might get migraine, they might get pins and needles in their fingers, they might get suddenly very tired. It can affect fertility. So we know around 6% of infertility is caused by celiac disease that's undiagnosed. And we can see lots of effects with it. There's a particular skin rash. It's got a great name. It's called dermatitis herpetiformis, which is a very itchy, blistery rash. And it turns up on the outside of your elbows and the outside of your knees. So celiac disease can affect a lot. People can have their hair fall out, they can have low iron, they can just have, it's a lot of people think of it just as being gut, but actually we know about 40% of people don't even get any gut symptoms.
Right.
So don't wait for the gut to go funny to think about celiac disease.
And do people often think they have something else if they get the symptoms?
Yes,
yeah,
very often. So it takes people 10 to 14 years to get diagnosed with celiac disease on average. Now, some people are quicker, but a lot of it is that they're not thinking about celiac disease. So people often think they have irritable bowel. So we know that around 20% of people with irritable bowel actually have celiac disease. We know that about 24% of people with lactose intolerance actually have celiac. People with psoriasis, there's definitely a lot more psoriasis and celiac disease. So around 10% of people with psoriasis can be celiac. So it's a lot of the time people don't think of kind of being celiac, because I think for a long time celiac was seen as a children's disease.
Yes.
It was seen that it only affected children and you lost weight and you had diarrhea. Whereas if people are not losing weight, which these days only 13% of adults lose weight with celiac disease, people aren't thinking about it. And it's a lot more common than we think. Years ago, they thought it was like, 1 in a couple of thousand. We now it's probably closer to 1 in 50 people actually have celiac disease.
And are the conditions always there? Say if an adult develops it, was the potential to have it always there from childhood? Or
celiac disease is genetic. So a full third of the Irish population carry the genes to have celiac disease, but it needs a trigger. And we don't know what the actual trigger is. We suspect it's some type of virus or maybe several types of virus. But it does run in families. So if you have a family member with celiac disease, you have a 1 in 10 chance of being celiac. So if you have a brother, parent, child who's celiac, the whole family needs to be tested, and that's really important to do. But it is there, and it definitely runs in families. So if you kind of have a bit of a funny tummy and there's celiac disease in your family, even with cousins, if you have a cousin, you have a 1 in 20 chance of being celiac as well.
And there are various tests when a person thinks they may have it. There are various tests that they have to go through. Yeah.
I mean, the one thing I'd say, the most important thing to do is to keep eating gluten. Because often when I talk about celiac disease, people think, well, I'll cut out the gluten and see, do I feel better? Yeah. Don't do that. Because once you cut out gluten, all of your tests will come back negative.
Right.
And that's what delays your diagnosis.
Yeah.
So the first thing to do is go and see your GP. Don't go anywhere else. Don't do kind of the sort of food intolerance tests or any of the other things that are out there. Straight to your GP. It's a blood test your GP can do. And if the blood test is positive, your GP will then refer you to a gastroenterologist. And for adults, you'll need a biopsy then. And most children don't need a biopsy, but some do. But it's very important to know the blood test on its own doesn't diagnose celiac disease. You do need to get properly checked and the biopsy. And you have to stay on the gluten. And that's what confuses lots of people.
Yeah.
If the blood test is positive, you have to still keep eating gluten until you have the biopsy done.
So people have to eat gluten for a certain period.
Yes.
Just to make sure. Yeah.
So if they've gone off gluten and they're thinking about getting tested, they have to go back on the gluten for about 6 weeks. Before they have the test done, because lots of people would have been tested negative and they're still feeling sick, but it's turned out they just weren't eating gluten when they were tested.
And there's no cure at the moment.
No, and there isn't even any sign of a cure. Like, we look at all the research that's coming out, and there's some nice research looking at medication to help reduce the symptoms of it. So about 40% of people with celiac disease, when they eat gluten, will feel very sick. They'll get a lot of vomiting. They'll have 2 days, miss work, the whole lot. So there's a lot of research trying to develop a tablet or a medication that can stop that reaction.
Right.
But there's nothing that's actually going to cure celiac disease itself. So the treatment is a strict gluten-free diet.
So it must have a considerable effect on lifestyle, at least in the past, before awareness grew about it.
It did, and today it still does, because 75% of people with celiac disease are not diagnosed.
Right.
So there's a lot of people walking around at the moment with celiac disease, and they don't know why they feel tired, or why they feel sick, or why their iron is always low, or their vitamin D is low. And lots of people are not joining the dots to think, actually, that could be celiac. So we've a lot of people whose lives are affected. And the problem is that if you're undiagnosed, later on, you're much more likely to get osteoporosis. So we see people breaking their hips and things at much younger ages. There's also an increased risk of a couple of different kinds of bowel cancer. Women are more likely to have miscarriages and stillborn babies. Men are more likely to find it difficult to become parents in the first place. So we really want to find people who are celiac but don't know it and actually get them help. But what's lovely is that it's a very treatable condition. So it is a gluten-free diet. I'm not saying it's easy, because the gluten-free diet isn't easy. But as kind of conditions go, we can do a huge amount to really get you back to normal once you're on the gluten-free diet.
So obviously finding the proper food is easier these days, is it? Because you have the options.
Well, anyone who's celiac listening is probably shouting at the radio going, no. So there's lots that's available. So things have definitely improved. So there's a lot more choice around gluten-free bread, gluten-free pasta, breakfast cereals and biscuits and things like that, which is brilliant. The really difficult bit actually for people with celiac disease is buying foods in packets. So we often know, the bread needs to be gluten-free or the biscuits need to be gluten-free. What we don't know is that you've actually got to check for gluten in everything. You can find gluten in mayonnaise. You can find it in ketchup. It's in stock cubes, chocolate bars. It is in so many foods. So the Coeliac Society of Ireland, we do a food list every year where we contact manufacturers and we go, right, what's in your food? And if there's no gluten in the ingredient, we then go, okay, what's on site? Do you have gluten on site? Is there a risk of contamination there? Because with celiac disease, if 20 millionths of the food has gluten in it, that is enough to actually make someone sick. That's 1 second in 11 days, if you think about it like that. So it's a very tiny amount. So even if it isn't have wheat on the label, if it may contain wheat, or if there's even any wheat on site or gluten on site, that's a risk for lots of people with celiac disease. So we talk about cross-contamination a lot, and that's the tough bit. So, we'll often see someone with celiac disease will have a separate toaster. And they'll have their own butter and their own jam and their own marmalade, because if someone else puts a knife in it, they've put gluten into it. So it does need to be really, really strict. And that's, as I said, the gluten-free bread is the easy bit, actually. It's the cross-contamination, and especially if you're trying to eat out in restaurants, that becomes really difficult to try and manage as well.
And I have a brother-in-law who's got it, actually, and he can't drink beer, but he can drink cider. Yes.
So the beer was the barley in the beer is the big problem. But cider, wines and spirits, thankfully, there is an option for people for that.
For eating out, that must be particularly tricky, all right,
It is. Now, I have to say, a lot of restaurants and a lot of chefs are fantastic. There's a lot more knowledge than there used to be, so there's brilliant, but there is still gaps with it, even in places that are excellent. So things like if you have a deep fat fryer, if you cook chicken nuggets in the deep fat fryer, that oil is now full of gluten. So if you cook chips in the same fryer, they're not gluten-free anymore. And lots of people don't think about it even at that level. Or, I was out recently and we'd 3 celiacs in the group we were with, and the hotel had brought out the vegetables in a dish with the potatoes. And they said, but the potatoes were fried in a fryer with gluten. And we're like, but now the vegetables aren't gluten-free either. And they're like, but because they'd all touched. So it does need to be that strict, which sometimes people think if you're a little bit crazy when you're celiac and you're like, well, I can't eat that because it's touched the other thing. But it does actually need to be that strict, unfortunately.
And how common are the linked conditions to most people?
So we would see a good few more. So we see a lot of other autoimmune diseases linked with celiac disease. So the 2 most common that travel with celiac disease are type 1 diabetes. So if someone has type 1 diabetes, they need to be regularly checked, maybe every 3 to 5 years for celiac disease. And underactive thyroid is another one. So if someone has an underactive thyroid, they also need to be tested for celiac disease, because they very commonly travel together with it. So they're the 2 big ones. But we definitely see more psoriasis in people. So we've done a study at the Coeliac Society with our members looking at other autoimmune diseases, so things like Crohn's disease and ulcerative colitis. The two big ones that we've seen, as well as the diabetes and the thyroid, is psoriasis and rheumatoid arthritis, or all types of arthritis as well, are much more common. What's interesting is they all improve with it. And one of the nice things coming out with the research at the moment is it looks like the earlier that you catch the celiac disease, the less chance you have of going on to get other autoimmune diseases. So in Italy, they're actually just passed a law there a few weeks ago. They're going to test every school child in Italy for celiac disease.
Right.
You're just going to screen the whole lot of them. And it's just fantastic. I'd love to see something similar happening in Ireland.
And the society itself, what kind of work does it do? Is it,
So, we've been around for a good long time.
Right.
We do an awful lot. We're very small, and I think, there's not many very big charities in Ireland. We're one of the little ones. So we've about 8 staff, and most of us are part-time to some degree. So we're working away. The big thing that we do is the food list. And one of the reasons that the food list is so important is people often think, well, reading the labels is enough for celiac disease, because if you look at the ingredient list and there's no gluten and then it doesn't mention gluten, that's okay. But we do know from working at the Coeliac Society that foods can have gluten in them even if it's not on the label. So what we do is talk to the manufacturers and we do that food list. I have to give a big shout out to Laura, who's the person at the Coeliac Society who does the vast amount of work on that, and it's a long, tough job. So that book comes out every year, and we have an app as well that people can use, and it means any foods in that are guaranteed gluten-free. So they're very, very safe for people to eat. What we also do is a lot of education, because as we mentioned, a lot of people are not diagnosed with celiac disease. So we do a lot of raising awareness. It's brilliant to come and talk to you today so more people can hear things that might be celiac. But we will raise awareness publicly. We're having our gluten-free living show in Cork. So it's a road show that we do. And we had the last one in Tullamore. And we're going around the country with them, and it's just bringing people in to talk about celiac disease. So it's for people with celiac disease, but also for people who think maybe they might have it. So we'll be in the Rochestown Park Hotel in Cork on the 22nd of October, and people can book tickets at the website. They can go through Eventbrite as well. But that gives people a chance to come in and talk to experts and raise awareness about it. But we would do a lot of education. So I would do education for GPs, for practice nurses, for dietitians, and all of that is helping to find more people with celiac disease. But also when it comes to sitting down and doing the diet side of it, it's quite complex. There's a lot to it, and people need to see a registered dietitian when they're diagnosed. So part of my job is that education side of it, so people are trained up. But we do a lot of advocacy. So the gluten-free diet is very expensive. The bread is 3 and 4 times the price. It's a lot more expensive for it. So, particularly if you have maybe 2 people in the family who are celiac, which is not unusual, suddenly it's a huge burden in terms of foods for that. So we've worked with the revenue, and we've got ways that people can claim for certain foods for celiac disease with that. Excuse me. And we are working with the government to try and get, there used to be years ago a sort of a dietary allowance if someone was on a special diet that was given to support, and it was removed. But we need to bring that back as well. And we do a lot of research, and we would look at research around celiac disease in Ireland and in other countries, and we go to international conferences with that. And again, it's raising awareness about celiac disease and encouraging other studies. We link in with other universities with it to do that.
How's the society financed? Does it get any government help, or does
We've
it
a little bit of government funding? So there is some there, but I think like everything else, we're very reliant on the generosity of other people who will do donations with us. We do have a membership fee, but we try and keep that as low as possible, because not everybody has a lot of money, and they're already trying to spend money on, the gluten-free products. So, we do everything we can to keep that membership as low as possible, kind of keep the lights on. So we do some fundraising obviously through the year as well, and things like the gluten-free roadshow and so on can help. And we do rely on sponsorship too. So, but the donations are the big one. And, I have to say members are fantastic. When the war broke out in the Ukraine, one of the things that happened was a lot of the refugees had no access to gluten-free products. So a lot of children were getting really sick. So I have to say the people in Ireland donated €16,000, and that goes towards, there's a European Association of Coeliac Societies, and we're continuing to support them as well to provide gluten-free products for people with celiac disease who have fled the Ukraine with that. So there's a lot of I think people are really good and generous about it, but I think like every small charity, it all helps.
I imagine with the fighting in the Middle East, that problem will arise again now.
and it's one of those things you don't think about unless you're that child who's, really sick and in a lot of pain and, need to try find food for them,
So does the Society have local branches? Do people meet locally?
So we do. We have support groups around the country, and if anyone is listening, they can contact the see-lee-yak office at see-lee-yak.ie, which is all our contact details are there, and we can send you out information on what your local support group is. And, it's a really good thing to join your local support group, because what I'd always say is they always know what restaurants in the area are safe. And I think for a newly diagnosed person with celiac disease, it's lovely to know, well, actually, all the other celiacs in the area know this restaurant is really good for me to go to. So that helps. But contact us. We do an awful lot online because, we've a shop in Clondalkin and the office in the shop. Now, it's only a small shop, but it actually started as a pop-up shop there about 2 years ago with kind of hard to get gluten-free foods, but it's proved so popular that it's still going. Now, it's small, but we do have some specialised, because a lot of people would never think of looking for gluten in herbs and spices, but it can be there.
Yeah.
So, and it's not always on the label. So we have gluten-free herbs and spices in the store. We have pizza bases. We have lots of chocolate for all the people who can't get nice chocolate. There's loads of things in there. So people are very welcome to pop in. The shop is open Monday to Friday, and then all the staff are there as well. So you can come in and lots of times people just come in, ask questions, get some information with us. But we do a lot online as well. So we do webinars. So I'll be doing one on bone health and celiac disease, and that's going to be just after the Gluten Free Roadshow. I think it is the following Wednesday. I should have that date in my head, but I think it's about the 25th of October. And people can register for that at the see-lee-yak.ie, and that's free. And even if you're not a member, you can join for that. So we do lots of events online, so that way everybody from around the country can access and find out what we're doing and ask questions, which is always the big thing. Whatever webinar I do, there's always loads of questions afterwards with it. And at the Gluten Free Roadshow there in Cork, I'll be talking about a topic which comes up a lot for our members, which is when the gluten-free diet isn't working. So when people are on the gluten-free diet, but they're still having problems. So some of the common things that turn up for people with that, and that's what I'll be covering at the roadshow.
Can those problems be kind of hidden, that maybe they're eating something they don't realise has hidden gluten in it?
That's the most common. About 60% of the time, it turns out there's gluten in something that they're doing that they haven't realised. What can also happen as well is that people might be sensitive to oats. So although oats themselves don't have any gluten, about 5% of people who are with the celiac disease will also react to oats. So sometimes you might need to take that out. Sometimes medications can be affecting it. Sometimes fibre can drop hugely when people start on a gluten-free diet. So they can get just really bowel trouble from that. So sometimes the fibre needs to go up. But also sometimes they've been misdiagnosed and it turns out to be something else. Or they can also have, there's a thing called microscopic colitis, which can travel along with celiac disease. So they might still be getting a lot of diarrhea, even though they're on the gluten-free diet. And so again, it's just checking back in with the consultant just to see if that needs to be checked as well.
Right. COVID must have been an additional complicating factor when it was going on.
I think for everybody. Now, a lot of people were so worried about it because, we saw a lot of people with certain conditions were at higher risk. But luckily, people with celiac disease are not at higher risk for COVID and can safely take all the vaccines. And that's really good. Though people with celiac disease are at slightly higher risk of pneumonia. So they do need to make sure they get their flu vaccine every year. And they do need to talk to their GP about some of the other vaccines around kind of chest complaints. And that's because some people with celiac disease, their spleen is affected as well.
Right.
And that can then in turn affect the immune system. But most people are fine. But it's just to make sure they are up to date with flu vaccines and so on.
And how severe can the reaction be if somebody inadvertently just eats a small amount of gluten? Can
Really severe. So it ranges.
Right.
And I think that's the thing with it. It's a little bit like a peanut allergy. Even the tiniest amount will cause the full reaction. But it does vary from one person to the next. So around 40% of people, even getting the tiniest bit of gluten, they will, within a couple of hours, will be vomiting, diarrhea, severe stomach pain, will be flat out for about 2 days. About 60% of people might get less. They might get a little bit of bloating, a little bit of discomfort. Some people might notice anything. But the reality is that whether you get a very dramatic response or a very mild one, the internal damage is exactly the same.
Right.
And I often describe it to people. It's a little bit like being pregnant. You can have two people who are pregnant and one has morning sickness and the other doesn't, but you're both just as pregnant. And it's the same with the celiac, because sometimes people will say to me, well, I'm only slightly celiac because I don't get the vomiting. Doesn't matter. Even if you don't, the damage to the gut and the rest of the body we see, unfortunately, are the same, whether you're the vomiting version or you're not.
So as we're coming towards the end, is there anything else you'd like to add?
No, I just really appreciate the opportunity to come and talk to you. And I would say if anybody has any questions, you can contact us at info@see-lee-yak.ie. The website is see-lee-yak.ie. We're on Instagram at see-lee-yak Ireland. So get in touch with us. And if you're not sure, you have any questions, we have helplines, and we spend a lot of time talking to people about how to get tested or if they think they might be celiac. So please do get in touch with us. We'd love to hear from you.
Right. Great. Thank you, Sarah.